Welcome to this presentation on safe abortion ecosystem and rolling back rights and WISH. My name is Ernest Yamato. I'm the Director of Quality of Care at IPAS, as well as the technical lead on WISH Lot 1 and Lot 2 as well. Just to give a brief overview, which Sarah has already given, and I will not spend my time repeating it. I think, as you're all aware, WISH focuses on partnership, delivering in difficult contexts, reaching the most poor youth and those living with disabilities, with opportunities to build on the first wish to strengthen policies and systems. Why this presentation is important is in the context of rollback, these strengths are even more significant. And we'll go into a bit of more detail of what we mean exactly by rollback. So overall, the objective of WISH is to enhance sexual and reproductive health and rights for women and adolescents, particularly marginalized groups such as those living in poverty, young women, and people with disabilities, by increasing access to integrated and inclusive SRHR policies. In particular, the program also seeks to strengthen policies and systems, social norms to create a supportive, enabling environment that promotes gender equality and supports an African-led demographic transition. So when it comes to WISH, Lot 2, Eastern and Southern Africa, this lot is led by IPPF in the following countries: Burundi, Ethiopia, Madagascar, Somalia, South Sudan, and Zambia. The lead partner is IPPF, working with IPAS, Options, Johns Hopkins University, and International Rescue Committee. As you note, also IPAS is also involved in WISH Lot 1 as well, and the approaches are going to be pretty similar, of course, with contextual adaptations based on the context and the countries. Just to go into a bit of more detail in terms of the specific 4 outputs for Lot 2, the first one is output number 1, that is on information, attitude, and social norms, which seeks to both understand and change social norms through community engagement, sustainable norm changes with youth and adolescent engagement, led by Johns Hopkins University, but working in partnership with all the other consortium partners. Output 2, led by IPPF, seeks to ensure sustainable, integrated, and inclusive access to reproductive health and rights, focusing on service delivery, leadership, and governance, linked to the health systems building blocks of the WHO, which is also very similar to what we are doing with the abortion ecosystem: health workforce development, health system strengthening, sustainability, that means embedding whatever is being done within government systems, and a clear focus on ensuring the highest level of quality of care, which is really linked to ensuring that women and girls are satisfied with the care that they get. And just as an aside, this will be measured through client exit interviews. The third output, where specifically IPAS is involved together with Options, includes, in summary, 4 components: health, financing, and sustainability, led by Options, as well as capacity development of civil society organizations, with a focus on gender equality and social inclusion. Specifically, IPAS will support work on access to safe abortion, as well as the rollback of rights. The fourth output is generating evidence and learning and evidence products that will contribute to global learning, but also will assist in supporting similar countries to learn on how to improve access to SRHR. Not to repeat, this is just a graphic. Again, the focus is on the most marginalized, people with disability, young women and adolescents in conflict-affected and fragile settings, with 3 components of service delivery, empowerment, as well as policy influencing. There's also a component on policy and systems, which here is going to be awarded later. The partners for evidence and learning are a third-party OPM, as well as Guttmacher, who are going to support in better understanding the incidence or the data around the incidence of and prevalence of unsafe abortion and access to abortion within the supported countries. So when we speak about output 3, that is safe abortion and rollback rights, the safe abortion component is going to be based on 4 things. The first is on what we call a sustainable abortion ecosystem framework, which is a comprehensive framework consisting of 8 components that I am going to detail, providing us a systematic way to look at sustainable abortion access. It is a 4-step process, and the implementation involves, first, in every country, ground softening and values clarification, which basically involves entry activities where we have not been working, that is South Sudan, Sudan, and Somalia, entry activities with the Ministry of Health and other relevant ministries, together with WISH consortium partners and also country managers who are coordinating country level activities uh, through IPPF. And this process involves identifying stakeholders and addressing access barriers. And the values clarification process, for those who are not familiar with it, is a way in which is an exercise or a process or an activity that allows us to shift and understand values around access to abortion, specifically reproductive health services, and helps us to shift attitudes and transform attitudes to access to SRHR services. We've been doing this activity for several years, and it has been critical in the countries that we're working in particular, in this case, Ethiopia, Zambia, and Madagascar, in helping us address access barriers. The next step is dialogue and roadmap development, which is the actual dialogue process where we administer tools linked to the sustainable abortion ecosystem to create what we call a sustainability roadmap. And it is this roadmap that is implemented by the Ministry of Health, working in partnership with identified and selected stakeholders to unlock access barriers to sexual reproductive health services, and in particular, abortion. This implementation is done within and with government systems, but working with the consortium partners as well. And it is in this 4-step process that we really see the value of your role in country in helping us identify channels and networks that we could work with and use during this 4-step process. Now, this sustainability roadmap is followed up through annual regular convenings to review progress and adapt our strategies as we go along. Again, I specifically mentioned working in partnership with other consortium members. We are going to take a tailored country level approach and we will not use a one-size-fits-all approach. We will tailor strategies to each country's legal, cultural, and health contexts, emphasizing political leadership and sustainable abortion roadmaps. So just to give an example, we have already started ground softening activities with Somalia, working with IRC. And what we did was share with them the dialogue tool to get ministries of health's input so that we're able to identify any sensitive information that might be in the tools that might need to be modified and adjusted based on the context in Somalia. So, for example, in some contexts, the use of the specific word abortion might create some sensitivity. So we're able to adapt that. For example, use the word post-abortion care, or in some other context, be able to identify it as maybe access to SRHR services, but with the specific understanding that access to post-abortion care and broader abortion care is embedded within the questions that are going to be asked. Again, further adaptations will be done when we are focusing on humanitarian and fragile contexts. In this particular context, especially in Somalia, working with the International Rescue Committee in addressing abortion needs in fragile and conflict-affected settings, advocating for policy changes and overcoming any barriers where we believe the restrictions might be a significant barrier. So, for example, in this particular context, using protocols like IWAG, the interagency working group, which has tools and processes that allow you to provide trauma-informed care within this context and is able to provide what's called a minimum service package, within which access to safe abortion is included, especially in humanitarian and fragile contexts as well. For the third output, rolling back rights, the background is there has been active opposition to expanding services for sexual reproductive health and rights in Africa, and under which we will focus on monitoring and countering this opposition as a core part of our work. There are 4 components, and again, I emphasize these 4 components are going to be adapted based on the context. But these 4 components cut across all the specific countries and regions that we're going to work in. The first step is doing an opposition landscape assessment, which is assessing the presence of opposition groups or individuals regionally and at country level, and the threat levels to abortion and SRHR services. Now, based off this landscape assessment, then we shall develop jointly mitigation strategies to counter the opposition through collaboration, working constantly with national, regional bodies and partnerships like the African Union, ODAS, Catalyst. Catalyst is a platform of partners including IPPF, IPAS, and FIGO that has been developed to counter opposition to abortion and SRHR services in Africa. As part of countering and mitigation, we shall also work with CSOs, media, community, and build community capacity. And in particular, I'll mention here working with champions, especially youth champions, but also other champions within countries on training and capacity building, on doing opposition mitigation within their countries. And we've been able to be successful in the past. And our role is going to be adapting the strategies we have used based on the context to mitigate opposition to access to SRHR services. A key component of evidence of mitigation is developing evidence-based resources for advocates to use when countering opposition to access to SRHR services. Because the bedrock of countering opposition to rollback of rights is ensuring the dissemination, the sharing, peer-to-peer, of evidence-based resources for advocates doing their work. Within which, it's important to note that all 3 components are interlinked. So the consortium partners will work closely together, that is IPPF, Johns Hopkins, IPAS, Options, and IRC, jointly together and undertake implementation activities, again emphasizing with the leadership from the Ministry of Health, because sustainability and government leadership and accountability is embedded within WISH, but is also embedded significantly within the abortion ecosystem approach and rolling back rights. The biggest threat, the sustainable abortion ecosystem, is rolling back rights. So the 2 are actually linked, and the work that we do in one feeds and enforces the work that we do in the other. Experience has also shown us that social norms, that is output 1, which I mentioned earlier, and stigma are often the greatest barrier to access to services. Overall, government leadership is key for buy-in, sustainability, and accountability, a key component for WISH overall. So when we speak about the sustainability of the abortion ecosystem, it's really about answering one simple question. If a woman needs to have an abortion, what are the factors that must be in place to ensure that she can successfully and safely have abortion care? It is the study and understanding of these factors that constitutes the abortion ecosystem. So a sustainable ecosystem is one in which resilient stakeholders and systems are actively accountable and committed to abortion rights and responsive to everyone's abortion needs. Let me emphasize here the idea of resilience and take the example during the COVID-19 pandemic. One of the first things that was affected when access to health services was limited was access to reproductive health services, and in particular access to abortion. So a sustainable ecosystem is one in which such shocks will not limit women's access to reproductive health services generally and to abortion services in particular. So why a specific abortion ecosystem framework. It's because we understand very clearly that access to abortion tells us a lot about the status of the dignity, liberty, and equality of women within any country, any region, or any context. It tells us about the political norms, the access to services, social norms, well-being, gender norms, cultural norms, their economic rights, personal status, educational opportunities, which we unlock as we have the dialogue process. And we believe when you develop a sustainable abortion ecosystem, you contribute to enhancing the dignity, liberty, and equality of young women and girls. So the framework that is used to guide programmatic and advocacy work has 8 components with 4 essential drivers, with a focus on the individual and the ecosystem surrounding them. I repeat again, answering that question: if a woman needs to have abortion services, what are the factors that are in place to ensure she can get these services safely? Those factors include individual knowledge and agency, the community and social norms, policy and legislation, the political support and leadership, health financing, commodities, health workforce and service delivery, and health information, underpinned by ownership and accountability from government, human rights and equity, partnership and collaboration, as well as local expertise. To go into slightly more detail, the abortion ecosystem components are built around the young woman and girl, and they start with what does the young woman and girl know? Does the woman and girl know about reproductive health? So individual knowledge and agency is at the center. And this individual knowledge and agency is affected by community and social norms. Women and girls are part of and form a significant part of the community. So what they know about reproductive health, for example, about their menses, about whether they can get pregnant, comes from their families, comes from the education system, and comes from the community. So during the dialogue process, we get to understand what is it that women in specific contexts understand. Do they have the agency to go through the decision? As mentioned earlier, a significant barrier to access to services is community social norms and support, and in particular, stigma and discrimination. And stigma operates at several levels: individual stigma, community stigma, and health worker stigma. A good example, and I'm sure you've had this example many times, is when health workers deny services to women and girls who come to access services because they feel it's something that they should not be doing. Community and social norms also affect the political support and leadership. And when we speak about political support and leadership, which is a significant pillar, this is critical. The politicians are the ones who develop the policy and the legislations. They can either tighten the policy and legislations and make them more restrictive, or if we advocate clearly, concisely, and sensitively, we're able to have policy influence to allow for the development of policies that can either decriminalize access to abortion, expand access to services, but most importantly, policy and legislation is what leads to financing. There is no financing or budget that is developed in any country unless there is a policy and specific legislation that allows for this financing. So when we speak about financing, it is how much does the government budget for sexual reproductive health and rights services? How much money is put into it through the government systems? Is this financing that allows, one, for the purchases of medical supplies and commodities, including contraception, but also abortion supplies and services? It is the financing that allows for the payment of the workforce, the hiring of the workforce, and the service delivery as well. All this is underpinned by the health information system. So we, during the dialogue process, also are able to understand what is the health data that is collected within the health system or within the health workforce. To improve the abortion ecosystem, there are 4 critical components that we address during the abortion ecosystem dialogue process. The first is ownership and accountability. So government involvement at every stage. So this process, the dialogue process, is led by and supported and gets support from the government at every stage for a total systems approach. This is because the government is the ultimate duty bearer, and only things that are done through the government are sustainable in the long term. We also take a very particular human rights and equity lens. Access to abortion is a human right because abortion is healthcare, and access to healthcare is a human right. We also focus on the fact that access to post-abortion abortion care is part of equity and dignity for women, again, which is another human right. We also focus on partnership and collaboration because we understand that no one partner is an expert in all the 8 components that I spoke about. No one partner understands the individual, the community, the political system, the policy, the legislation, or the health system. So during the dialogue process, we make sure we identify all the key stakeholders that can come and speak clearly to all to the specific 8 components, and we put them together in a room. And often, most of these stakeholders have never been in a room together. So, for example, people from the Ministry of Finance as relevant, people from the community, from CSO, and from women and girls organizations that support women and girls, sitting together in one room with people who understand abortion commodities, with implementation partners and donors. They sit together in a room and they're able, through the dialogue tool, to understand. Now, this is where partnership and collaboration comes in. And we also recognize that in every country, in every setting, there's local expertise. There are local partners who are already there. So we don't come in and establish anything new. We come in and work with local expertise, and our role is to provide technical support and capacity strengthening in undertaking the abortion ecosystem approach and implementing plan. We also note the significance of partnerships, ensuring that we address the intersections based on the context. So, for example, humanitarian settings, livelihoods, universal health care, gender-based violence are all critical components, as well as other intersections including disability, climate justice, youth adolescent rights movements, as well as health and gender justice as critical components. So based on the context, we adapt the tool to be able to address the significant intersections that apply to that particular context. So in terms of practical implementation, the abortion ecosystem programming approach is really a dialogue process that starts with the ground softening, entry activities, stakeholder planning meetings where we meet the Ministry of Health with partners. We identify which stakeholders need to be at the table, and using the dialogue tool, we're able to go through a series of questions that allow us to unlock the existing state of all the 8 components and use a scoring system to identify the sustainability of each of these components. Then it's after having the dialogue process that we do a sustainability and action plan. We develop an actual plan that is going to be implemented, looking at indicators, and it's the implementation of this plan that will lead to the strengthening of the sustainable abortion ecosystem. So in terms of sustainability, and again, I apologize that this is a high-level summary. We do have more details for those who request. We look at the specific 8 components. We use this scoring system, and we consider, for example, a component as sustainable if it scores a maximum of 4, and unsustainable if it scores less than 2. So during the dialogue process, we score and come up with a score. I'll give an example. So we consider components sustainable if we understand that abortion or post-abortion care is widely available and accessible, the stakeholders are empowered and they understand what is going on and they can provide services, and there is opposition, but it is limited. And we consider it unsustainable if there's little or no support to abortion or post-abortion care, there's general silence on abortion and abortion-related stigma, and there's organized opposition towards and open hostility towards abortion. So here's a specific example. I'll give the example of Zambia, where in 2020 we had this ecosystem abortion dialogue. I led the process of discussing this dialogue and developing the sustainability plan together with the team in Zambia. As you can see, we went through the process, and again, our role is to assist in the dialogue process, and it is the stakeholders themselves who go through the process, understand what is going on, and then come up with the implementation plan. They don't I think what is important to understand is during this process, the stakeholders are supported and guided to identify the highest priority activities that are feasible within the context. So not everything is feasible, but specific incremental steps. So it's about incremental steps that can be taken to strengthening the abortion ecosystem. So in the instance of Zambia in this case, the component that was found to be wanting in terms of sustainability was financing, as well as community social norms and support, and individual knowledge and agency. So those three were selected for the development of a sustainability map. As noted earlier, that's not to say that the other components are not going to be addressed, but it's that the stakeholders identify these are the three components they will follow up over a 1 year period and implement to enhance the sustainability of the abortion ecosystem, with the sense that the other components were moving along in a much stronger way, but these three are the ones that will be supported. So I just will mention one example, the social norms and community one, where one of the things they realized was they need to change the social norms and the activity. This is a high level activity, but this is broken down into specifics. What is needed to support? The partners are able to identify so the partners themselves identify that they offer. So you identify the partners and they say, we can do the specific implementation of activities, the areas where the support will be done is actually done, and then it is tracked and implemented. Similar thing, responsive and inclusive service provision for safe abortion. In particular, for Zambia, looking at disability inclusion. So the partners identify the regions where they need to implement these services, of course, what is manageable. Then there's a review that is done regularly. Now, at the country level, the approaches are going to differ. We have divided this into three based on the context. For Burundi and Sudan, we shall do a comprehensive ecosystem implementation approach. So this includes ground softening, VCAT session, working with the Ministry of Health in planning, monitoring, and adapting the roadmap through annual meetings with key rights holders to ensure sustainable abortion care. For Somalia and South Sudan, we shall adapt the approach for the fragile context, understanding the fragile legal settings and leveraging frameworks like the Maputo Protocol, the World Health Organization guidelines to address barriers and protect sexual and reproductive health rights through strategic partnerships. So in particular, IRC and other humanitarian actors within the country. So in this particular context, the idea is to identify what can be done within this specific context. Same will apply for Sudan as well, and because it's also a fragile context, to ensure that we identify and we're able to contextualize the approach to that particular context. For Ethiopia, Madagascar, and Zambia, we shall do what we call the light touch approach. Because in these three countries, we've been in Ethiopia since 2000, we've been in Madagascar since 2020, and we've been in Zambia since 2006. In this particular context, we have already done the abortion ecosystem dialogues. So what we shall do is strengthen national ownership of existing sustainability roadmaps through annual meetings with the Ministry of Health to ensure accountability and progress in abortion ecosystems. I'm very interested in hearing your views, but what we see as the importance of FCDO, and this also applies to the rolling back rights, is supporting ground softening based on the context in identifying allies, risks, and partnerships in country. In terms of policy advocacy and engagement, your connections to networks and high-level dialogue within country will be critical. Also very important is, as you can see, the ecosystem is interconnected and is intersectional. So the work that you do in other projects, for example, in education, gender, and livelihoods, will be important for us. So your links to these programs, in terms of them either participating in the dialogue process, helping us understand, but also being able to identify stakeholders and partnerships and synergies will be critical. I'm also very interested in hearing from you what else you can contribute and help us to better understand the ecosystem and rolling back rights as well. So the second component is roll back women's and girls' rights. So the most important thing when we look at rolling back rights is opposition monitoring strategy. And for us, it is to never work alone. Again, just to mention, there is significant opposition to expanding services, which is very active in many parts of Africa. And the 4 components are going to include landscape assessment, countering the opposition, building capacity, and developing evidence-based resources for advocates. I emphasize once again that this approach is broad, but it's going to be contextualized to specific contexts. One of the things I really want to emphasize is that the opposition in every country, in every region, is extremely dynamic. There are partners exiting and entering at intervals that cannot be predicted, which means the vigilance for opposition monitoring is constant. It's not something that you do once. For example, you do a survey and then use that survey endlessly. No, we are constantly monitoring opposition. So at IPAS, this is what we've been currently doing in our approach to rollback. For us, research is a constant thing. So we are constantly researching and understanding what the opposition is doing, developing a newsletter, for example, anti-gender updates, and publishing this on a regular basis on the website. So for us, research is the cornerstone of the work that we do. Partnerships. The most important thing in opposition monitoring and mitigation is partnerships, because no one partner can do it alone, but also because when we work as movements, we are much stronger. So we have developed what we call the rapid response teams in Kenya, Uganda, Tanzania, and DRC. We work with coalitions of SRHR partners at the global, regional, and national levels, including ODAS that I mentioned earlier, that has IPPF and FIGO. We work with Catalyst, we work with ODAS in West Africa. We work with African Union, we work with African Commission on People and Human Rights, we work with the UN Treaty monitoring bodies, and in particular, we support young people because they are often the most affected by misinformation. A key and important part of opposition monitoring and mitigation is sharing information. Working with the media on opposition activities, alerting and educating like-minded donors, and developing response strategies. Coordination in regional and global spaces is critical. We work in coordination, opposition monitoring at UN and other spaces, work with treaty monitoring bodies like the African Commission on People and Human Rights, with donors, CSOs, and multilateral agency partners to preempt and respond to opposition threats. So a quick snapshot: monthly Eye on the Rights newsletter, social media tracking of opposition actors, online secure databases, monitoring mainstream media, as well as infiltrating opposition activities to better understand what they're doing. I think a key word I'm going to mention is we take a very risk-aware risk mitigation approach, because opposition, the work that we do around understanding the opposition can be risky, it can be dangerous, both to the partners, to the beneficiaries, but also to the work that is being done in country. So we try to do it in a way that is very sensitive, which means a level of security is required, a level of digital training is required as well. So the opposition landscape assessment that we do in country is we conduct country and regional level analysis to understand opposition dynamics, the relationships, to improve how we're going to frame our responses and identify monitoring allies. As I mentioned earlier, the level of opposition in a country is dynamic. It's constantly changing. What you'll analyze this year, this month, might change tomorrow, might change next week, might change next month, because a new individual or partner might come in, funded from the outside, to start undertaking opposition activities. So constant vigilance is the basis. So this opposition landscape assessment is not just a one-off. You start and you continue it throughout. Of course, the initial baseline assessment is critical, but ongoing monitoring is also vital. So we work to build a centralized system for tracking individuals, groups, and activities. So this centralized database, which we secure, is shared within the partnership and is used to frame the response. We map relationships and trends for broader understanding, because often the opposition doesn't just work in isolation. You might find what they do in one country, they coordinate and do it in other countries as well. So, as much as it's important to understand the context, say within Sudan and Somalia, you might find opposition activities might be coordinated to affect multiple countries as well. So, taking a country level approach that is contextualized, but also a regional level approach is absolutely important, and even a continent wide approach is critical. So, we do baseline and ongoing monitoring, especially around key events and activities, the meetings that are ongoing, because the opposition loves attending these meetings to affect policymakers. So we're constantly, any convening that happens at a political level, or UN meetings, for example, the Conference on the Status of Women in New York is a place where the opposition likes to be seen and to attend. So, for example, you may have an activity that is happening in the US, but what is happening in the US in terms of that activity in New York will affect what is happening in Africa. We use visual tools for interconnected data representation, for example, little CIS. So in terms of countering opposition, for us, the most important thing is coalition building with governments, young people, Ministry of Health, and advocates, working with international and regional bodies, but mentioned as well, and the rapid response team approach. So this rapid response within countries and regions, they proactively monitor and counter opposition by gathering intelligence, analyzing opposition strategies, and implementing targeted interventions. They collaborate in particular with youth champions, community stakeholders, to build capacity and ensure coordinated, informed responses to safeguard. So, what specifically, you might ask, do they actually do? So, share information, peer-to-peer learning. Based on the context, the mitigation activities may include disrupting opposition activities, putting out media briefs, training youth on how to respond, providing accurate information, and countering. But again, let me emphasize, the response are contextualized based on the countries and based on the risk. So it's not always that you shall have, in some contexts, you can't have a rally because it will be unsafe and it will be dangerous. Some contexts where we've had policies that have been in place for a long time and there's more freedom, for example, some of the work we've done in Kenya, you're able to actively reach out to the media, actively advocate. Whereas in another context where it's a bit more sensitive, a lot of work is done in the background, out of the limelight, working with advocates and stakeholders to protect rights. So it's very nuanced, very contextualized. And this is where investing in research and monitoring is critical. Digital security and training is very important in developing of safe spaces, and especially creating coordination spaces, which is what the rapid response team is. But other coordination spaces are also developed, especially encouraging peer-to-peer and country and regional level advocacy and community mobilization. Again, let me mention risk awareness and mitigation is critical. Evidence generation is vital because addressing misinformation is key to which program broadly. Monitoring opposition social media, regular review of traditional and online media, collaboration, attending and observing public and online events, taking security precautions as needed, and documenting findings systematically in spreadsheets or databases for easy tracking and analysis. Capacity building in terms of sustainability is critical. We prefer to develop the capacity of civil society actors within countries to undertake the opposition monitoring and mitigation themselves. We start them off, we support them, but hopefully in terms of long term, they are able to undertake these activities themselves, including youth partnerships and government, develop the rapid response teams, and they're able to mitigate and monitor the opposition. The critical thing to understand is, in the past, we've often been very reactive to what the opposition is doing. We are trying to move towards being proactive, actively identifying threats and mitigating them as before they happen. However, this is an ideal and often reacting may be the only option that you have, because the opposition is fluid, it's dynamic, and it's very active. Engagement with media is also critical. So some specific examples, we were able to do event disruption through policy briefs and media at the UN. We were able to disrupt and have protests. We were able to disrupt a fundraising platform, and we document this lesson. But again, let me emphasize, The context matters. These are not strategies that you take from one country and implement in all of them. It depends on the legal and policy environment and the level of restriction. So the activities and how you do them are adapted based on understanding the context.